We have in 10th episodes of Phatak Materia Medica live series. So today's remedy is Asculus hippocanthus. So let us start with the common features of Asculus. So Asculus is a must known no remedy for general practicing homeopaths. Before learning symptoms and understand why this is remedy is important. Many doctors treat piles separately, liver separately, back pain separately, but Asculus teaches integration of these all complaints. According to Phatak Materia Medica, Asculus acts on the veins, not on the arteries. Which veins they mostly acts? Veins of the lower bowel veins, pelvic veins, portal system, and lower extremity vein. So this is a remedy about venous stasis, not stasis. Venous stasis means gorging or accumulation of venous blood and congestion of venous blood. So asculus does not inflame, asculus congest at the venous level. So core and understanding of the asculus is slow circulation, venous congestion, pressure and fullness. So let us understand how this happens. In the patient, blood moves slowly, veins overfill, organ feels heavily and pressure builds. So this produces fullness, heat, dryness and roughness. So asculus patients are full, blocked and uncomfortable. So the blood moves slowly, veins overfill, organs feel heavy and pressure builds. These conditions, in many pathological conditions, we may see in this. We may see in hemorrhoids, piles, we may see in varicose veins, we may see in chronic liver diseases with esophageal varices or in chronic liver diseases with varices with ascites. So there is fullness, blood moves slowly, pressure builds and organ feels heavy. So the asculus personality patient lives in the internal pressure, they feel stuffed, they feel loaded, they feel burdened. They often says that doctor, I don't feel light at all. This heaviness is in the both mental and physical level. Venous congestion affects the mind and body together. So asculus is not an anxious remedy. It is a dull, congested mind, gloomy, irritable, cannot fix attention, mental fatigue, wake up with confused. In OPD, we may see that patient may say you to that, doctor, my mind feels foggy in the morning. This is not a depression, this is a sluggish circulation to the brain. So modalities, time modalities of the asculus hip is worse in the morning on the waking. Morning aggravation is very important. In temperature, worse from cold air, worse in the winter, worse after washing in the water. Cold increases the venous stasis. So morning aggravation and cold temperature aggravation. Motion and position, we may see that standing aggravation, stooping aggravation, lying aggravation, after stool aggravation, after urination aggravation. In better, cold open air better, bathing better, continued exertion better. So that rest worsens the venous congestion, gentle movements improves it. In the particulars of the asculus hip, we can see that head and upper body congestion, typical bruised brain from the occiput, forehead, flushed all over head, occiput, neck and shoulder. So there may be, patient may say that heat rises from the back of the neck, heavy eyes, dull, hot, lacrimation, blood vessels enlarged. The passive congestion in the eyes, not a inflammation. In nose, throat, this is a, if the all symptoms come together with piles and backache and venous congestion and migraine, we may think of asculus. In nose and throat, nose sensitive to cold air, burning, rawness, sneezing, fluent coryza, nasal obstruction due to the hepatic disorder. In tonsil, follicular tonsillitis, it is one of the great remedy. Roughness, dryness, burning on swallowing, hawking of ropey and sweetish mucus. Whenever liver is congested, with throat and nose complaints. Stomach and digestion, everything is slow. Digestion is sluggish. Pressure like a stone. Gnawing pain appear after hours. Heartburn, gripping up the food, desire to vomit. So symptoms are from stagnation, not excessive acid. Due to the portal congestion, the digestive system become slow. In abdomen and liver is the main axis of the AESCULUS hip. So this is an important section for the AESCULUS. Abdomen feels full, heavy, tender. Liver soreness, fullness, congestion, jaundice. There may be deep throbbing pain in the hypogastrium, pelvic pressure. AESCULUS piles are due to the portal system problems. So another very important part of the back, why the pain starts here. Even though back pain is detailed, venous congestion in the pelvis, sacral heaviness, lumbar strain, back gives out. Back pain is the reflection, not a separate disease. In back pain, the AESCULUS is one of the key remedies with sacral joint involvement. And last but very important part of the AESCULUS is the rectum. So rectum complaints are the main key to remember for the AESCULUS. Key rectal sensations are, we must remember the all sensation of AESCULUS. Feels as if rectum is full of small sticks. Rectum is full of small sticks. Sensation as if something rough inside. Burning in the anus with chills up and down in the back. Pains like knife swaying up and down. There are not mild sensation, they are peculiar and confirmatory. When patient uses strange description, think characteristic this of remedy. In piles, AESCULUS piles are purple, painful, engorged, external and blind, sometimes bleeding. Mainly non-bleeding piles indicate the AESCULUS, but sometimes bleeding. Bleeding is the not main feature. Main feature is pain, pressure, congestion, backache. Modalities of the piles are worse on standing, walking, after stool, during climacteric. Relief, bleeding, kneeling and continued motion. AESCULUS piles are painful because of the veins are overfilled. Stool patterns is very important. Stool characteristics are hard, dry, knotty, difficult to pass. Sometimes first part hard and black and latter parts white and soft. Pain during and after pain during stool and long after stool. This pain after stool is very important. Pain after stool, backache, back pain, think of AESCULUS. Back pain, venous congestion is the soul of this remedy. So AESCULUS back pain has unfits patients for business. This sentence from the Phatak is gold one. AESCULUS has a back pain that unfits the patients from business. Nature of the back pain: dull, lambing, bruised in the lumbar and sacrum and hips. Patient may say to us in typical way that my back feels as if it will break. Modalities, again same modalities: aggravation by standing, walking, stooping, rising from sitting. Better by continued exertion or gentle exertion. Better by cold air. Back pain from the pelvic venous congestion, not from the muscle strain. So the two characteristic comes together, back pain and piles, the indication of the AESCULUS. This is the important point, that pelvic venous congestion causes pressure in the rectal veins, and that leads to the piles. means pelvic venous congestion uh, causes the pressure in or engorgement in the rectal veins and causes the piles in the asculus, and pressure in the sacral plexus causes the back pain. So these are the anatomy physiopathological correlation of this remedy. If you treat only piles, back pain will persist. In asculus, piles and back pain are two phases of the same diseases. Also, one remedy that have a back pain with characteristic, that is kalika, have back pain, constipation, and weakness. So, differentiating point of this. In female pelvic system, there is also congestion in pelvis, uterus, and sacroiliac joint, throbbing pain behind symphysis pubis, leukorrhea, which is dark yellow, sticky, corroding, worse after menses. Also, these are associated with lameness in back, aching in the knees. Pelvic symptom, back pain and piles is the asculus. In males, discharges of prostatic fluids at the stool, at the urination, that confirms the pelvic venous congestion. In extremities, limbs aching, sore, paralytic heaviness, hand and feet which swells, becomes red after washing, spine feels weak, gives out. Venous congestion produces heaviness, not a sharp weakness. So, we need to differentiate the many more remedies that are related to the rectal symptoms and piles. So, let us differentiate some common remedies. Aloes. Aloes has sudden urging, jelly like stool, worse in the early morning, more diarrhea. In asculus, hard dry stool, no sudden urging, marked back pain. Urging is aloe, back pain is asculus. Another remedy is asculus versus colonsonia. Colonsonia has more constipation, more anxiety, less back pain, with more heart symptoms, or heart symptoms are associated with that. While in asculus, more venous congestion, more pelvic pressure, severe backache. When backache dominates, asculus is the remedy. When constipation, after pregnancy, and with heart complaints, colonsonia dominates. Asculus versus pulsatilla. Pulsatilla is also one of the good remedy for venous congestion. Changeable symptoms in pulsatilla: emotional, better from consolation, changeability of the symptoms is the pulsatilla. Will fixed pathology, dull heaviness, no emotional dependence is the asculus. In remedy relations section, Phatak gives some clinical sequelae of the asculus, that are carbovage, which is complementary and in venous collapse, lacasis in intense venous congestion, muriatic acid in exhausted venous system, and these remedies are sequelae of the that. So, in rectal and back complaints which combined, we should give asculus, and then after we can follow the constitutional remedies. So, the key to prescribe asculus, and most important thing is the potency selection. So, 30 and 200 are the best potencies in the piles with back pain, which are blind piles. In some of the cases of piles which are not responding, or which are dependence on the painkiller or Ayurvedic medicine, and they require immediate relief, asculus mother tincture also used. Another indication of asculus mother tincture I regularly use in the cases of patient having piles with varicose veins, or piles with backache with varicose veins for long duration, as a organ supportive remedy is asculus in mother tincture. And in the cases of liver cirrhosis with ascites with piles, the Aesculus is the key remedy. Aesculus helps to reduce the ascites in many cases in mother tincture, and gradually results started then increasing potency 630 to 100. So, these are the potencies of the Aesculus. So, golden rule to prescribe Aesculus if back pains remains, this remedy with venous congestion with piles is the great remedy. So, back pain, piles and congestion, these are the main key or highlights of this remedy. Aesculus teaches us treat venous stasis and then body become lighter. So, thank you very much for patience listening. Thank you. Now, we will see in the next session.